I want to talk about sex. I want to talk about it because this is just like a part of my world anyway, right? I get to like pelvic floor PT. We talk about pee and poop and sex. And I love that. I'm a 12-year-old boy on the inside. So, what's not to love about that? But what I don't love is when people, and this is happening a lot lately, people are coming to me saying that sex is painful. And what I love even less, what I really, really don't love at all, is when people come to me saying, it hurts and it's supposed to hurt, right? No, 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 no. Okay, so your mother told you it's supposed to hurt and she should call me too. Or your college roommate said it's supposed to hurt and she should call me too. It is not supposed to hurt. It's supposed to be fun. It should be fun. We should love it. There are 2 times in a female-bodied person's life when penetrative sex is gonna hurt, and that's normal. And it actually, what does hurt is me saying that this thing is normal, because I really, really, really hate saying it. But okay, the first time is the first time. Like the first couple times, maybe. Like it is, it's supposed to hurt. I mean, I don't know what to tell you, but couple times, right? And maybe the first time or two with a new partner, as you guys are kind of figuring out each other's bodies. As far as your partner is concerned, it should not hurt. And as far as you are concerned, you get to say when it hurts or whatever. Like, okay, so that's one time. And then the other time, this is one time when it is normal to have age-related changes. And when we go through menopause, estrogen drops. Lower estrogen causes the tissue in the vagina and the tissue in the whole vulvar region to become more sensitive, and so the tissue can be irritable. And if the tissue is like dry or frail, then sex can hurt. And it does not have to be that way. Yes, it's normal. No, it's not okay. I just need to say real quick too that there's still kind of like this body of even healthcare practitioners, even doctors, who are saying that HRT is comes with a risk of breast cancer, and that's just false. Hormone replacement therapy is safe for most of the population. If you have a history of cancer in your family, I mean, either way, you should probably talk to your qualified doctor about it. If your doctor is saying this is a dangerous thing, find a new doctor. If they're saying it's dangerous for you, because that is something else, right? But HRT is safe, and it's a quality of life thing. Just sex, right? It hurts, and then it's fun. Quality of life, right there. Boom, made it better. So HRT is safe, and it can really improve your quality of life, and it will make it so that this second time in your life where sex is normally painful, it doesn't have to be that way anymore. And that's wonderful. There are some other reasons that sex might hurt. One of them is that you have not had normal instances of sex. You have had trauma, sexual trauma or otherwise, and it makes you not trust sex, not trust other people to be with your body. And I get that. And we still want sex to be fun for you. So let's find out how that's living in your pelvic floor and make it go away. And another time, if your pelvic floor is gripping for any other reason, even if it's not trying to keep you safe, if it's just used to gripping, your pelvic floor is your core, right? So if it's a control freak, ask me how I know, then it can be gripping, and muscles that are gripping are sensitive. So the muscle might not be loving sex, but also when the pelvic floor is gripping, the size of the orifice changes. So, it's not exactly a square peg in a round hole, but you see where I'm going with this. If it doesn't fit, it hurts. And that would be another way that high tone or muscle, too much power in a muscle might be affecting sex. And your pelvic floor actually does have a role, it should be turning on during sex. So if your pelvic floor is already working too hard and then you're asking it to do its own job, you might be encountering a whiny, complaining pelvic floor because it's overloaded. All right. And another time that your pelvic floor might be might be resisting sex, even if it is otherwise happy. Even if on its own, if you were to put it on like a beach with a Mai Tai, it would be a perfectly well-functioning pelvic floor, but it doesn't exist in isolation. It's not on a beach with a Mai Tai, it's between your hips. So maybe it doesn't like what your hips are doing. Maybe it doesn't like what your back is doing. Maybe it doesn't like the way that you're pressurizing your belly, because your pelvic floor is your core. So it's going to react to everything else that's happening in your body. And maybe it's not coordinated, or maybe it is coordinated, but it just has a bad experience with when your hip abducts and externally rotates. Like, that's something that's fixable. We can do that. Anyway, if sex hurts, call me. Call my naturopath friend, Dr. Joanne Gordon. She's right down the road in Oregon City, and she can help you with your hormones. But it should be fun, and let's make it fun, because this is a time of indulgence. Wine and chocolate and sex. Why not? Make it fun. All right, anyway, I look forward to hearing from you. I look forward to talking about sex with you. And it is okay to be choosing pain for sexual purposes. If that's what you're into, then like, by all means, do the pain. But it's a choice. And if it's not a choice, that's when I want to hear about it. All right, take care.